Welcome. I'm Dick Larson from the Center for Wellbeing in Colorado Springs, Colorado. Rolfing is named for Dr. Ida Rolf, a woman who received her PhD in biochemistry from Columbia University at age 25 in 1920, back when it was rare for women to get a PhD. She was hired by the Rockefeller Institute to study fascia, the most abundant tissue in our body. She called her work structural integration. Her focus was on the structure of the body, how you stand, how you move, your alignment, range of motion, and so on, and particularly how your posture affects your everyday life. But the name structural integration is a pretty big mouthful. So people just started referring to it using her last name. Oh, you're going to get Rolfed. Oh, yeah, I'm going to get some Rolfing. Rolfing releases tension, improves posture, greatly relieves chronic pain. It enhances neurological functioning and balance and reduces stress. So let's talk about fascia and its importance in the body. So Dr. Rolf discovered that it is fascia that holds tension in the body. It holds tension, but it doesn't know how to let go. The body is playing it safe, keeping things stabilized, which is what the fascia is doing. So because it surrounds individual muscles, when somebody says, oh, my trapezius is tight, it is not the trapezius muscle that is tight. The trapezius is a muscle. It only contracts in response to a nerve impulse. What is actually tight is the fascial envelope around the muscle, which then leads to an uneven pull on the tissues in the area. Fascial restrictions can pull the body out of its normal alignment, compressing joint surfaces and bulging discs, and this results in pain, loss of motion, and weakness. Here's a quick way that I introduce fascia to my clients. Grab your shirt or blouse or whatever you have right at the navel. Pull it straight out and then straight down. Do you feel that in your neck? Of course you do. So when someone comes in and says, I've got neck pain, they expect me to work in their neck. But if I only focus on the neck where the symptom is and ignore that there's this tight restriction down here at the navel, whatever relief I give them will be very short-lived. So back to Dr. Rolf. She realized that the tension in the tissues leads to the blocks of the body becoming turned, twisted, and tilted in relationship to each other. She also recognized that the predominant force impacting our bodies all day, every day is gravity. 24 hours a day, there is a pull straight down towards the center of the earth. So as we grow and get injured, for example, learning to walk and falling, having an accident on our bicycle, or injuries that come with sports and gymnastics, falling out of a tree, all the things we do to our bodies through our life, digging a ditch, or maybe you grew up on a farm and helped the family to load heavy bales of hay. You can assume nobody in the family instructed the youngster how to properly lift and throw. So we injure our body and the fascia accommodates the body, trying to reduce the damage done by restricting it to a single area. But remember that the whole body is connected. And so if there's a strain in the low back, that pulls on the fascial web, and then there's a neck pain, or maybe the knees start to be unsteady, or whatever might happen. Rolfing works by counteracting the effects of gravity, which over time pulls the body out of alignment. So again, this is out of alignment. So we've all seen older citizens who are becoming more and more stooped. By freeing up the fascial tensions, Rolfing will lengthen the tissues and release their pulling on the body out of alignment. This pull causes the body's connective tissue to become harder and stiffer, and the muscles begin to atrophy. Signs of the stiffening and contraction include slouching or an overly erect posture. Dr. Rolf adopted this drawing of a child whose body blocks were turned, twisted, and tilted in relationship to each other. Most of us have had injuries in the process of growing up, as I spoke about a minute ago, and so the image on the left is a normal body paying the price for injuries and gravity. The aim of Rolfing is to bring these blocks into alignment with each other and with gravity, and that's represented by the image over here. We need 10 sessions to do this systematically, to oversee the entire structure, because although you may have a pain symptom in your shoulder, I know that just to work in your shoulder where the symptom is won't address the entire issue. I need to change how you are standing on your feet, the relationship between your pelvis and your rib cage, and more. These are pictures of people who've been Rolfed and how their body responded. This is somebody before any Rolfing, and this is after 10 sessions of Rolfing. Same thing with this woman, before any Rolfing and after 10 sessions. With Rolfing, the client is supported in standing straighter and, in the process, gaining height. When I originally went through my initial 10 sessions, I gained 1.5 inches in height. It isn't that I somehow grew, but just as a rag shortens when twisted, the Rolfing process will open and untwist the body. So who typically comes in to receive Rolfing? 3 main groups. Most people come in because they are and have been in chronic pain. My back hurts, my neck hurts, my knee or my hip gives me trouble. The second group who come in aren't necessarily in pain, but they're using Rolfing to help their body to work at a higher level. So athletes, dancers, those whose body works fine, but they want it to work better. The third group is wise enough to utilize Rolfing as preventative medicine. Perhaps they watched their parents deteriorate and they don't want to follow that path. Or they smartly realize that the consequences of having led an active full life is that there will be mishaps along the way, perhaps they seem to have healed from, but in the big picture, all of the disorganizations will have a larger effect than one can ignore. One last note. Rolfing has a reputation for being quite painful. This is Dr. Rolf Rolfing a baby. Does this baby look like it's in great pain? When I went through my initial 10-session series back in the 1970s, it was incredibly intense. But by the time I trained, they'd already started to look at how can we get the same result without traumatizing the patient while we work. Now I find that patients tell me that their massage therapist is more painful. And every week I have at least one client fall asleep while they're getting a Rolfing session because it's relaxing, it isn't an attack. I'm often asked, how is Rolfing different from chiropractic? Chiropractic focuses on the hard tissue, the bones. Rolfing focuses on the soft tissue, the connective tissue, which is what holds the bones in place. Chiropractors love it when their patients get Rolfed because we free up the tension in the soft tissue, allowing the chiropractic adjustment to go deeper and to last longer. I suggest that you watch my video detailing my own personal story and how I got into Rolfing. I was certified in 1979 and this is 2023, so I've been doing it for 44 years now. I offer a free half-hour consultation if you have questions or you want to discuss how Rolfing might help you. Also, if you'd like to learn more about me, please view my video called My Story.